The dental assistant has many responsibilities during basic extractions in oral surgery. These responsibilities include preparing the operatory, maintaining methods to prevent disease transmission, transferring instruments, maintaining a clear operating field, watching the patient during the procedure, and giving post-operative instructions. In this program, you will see the tasks required for assisting during a simple extraction procedure. The patient is returning for a scheduled extraction appointment. Before the patient arrives for the procedure, the operatory is prepared. All equipment is sanitized with an X-ray wipe. The most recent periapical radiographs and the panelips are removed from the patient's chart. The periapical radiographs are placed on the view box for the oral surgery procedure. The patient's chart and treatment plan are read to determine the procedure to be performed.
We're going to need a 150 forceps and root tip picks.
Okay.
The forceps, extrasurgical instruments, and basic extraction tray are obtained from central sterilization. Before opening the basic extraction tray, the dental assistant does a hand wash. The basic extraction tray is opened. And then checked to be sure all of the instruments are there. When opening the wrapped tray, the dental assistant makes sure that the inside is not contaminated. Additional instruments are placed on the tray. The bagged forceps are opened and allowed to drop on the basic extraction tray with the other instruments. Next, the root tip picks are opened and dropped onto the tray. Then, the entire tray setup is covered with a sterile towel. The assistant escorts the patient to the operatory and seats the patient. To begin the procedure, the patient's medical history is updated.
Has anything in your medical history changed since we saw you last?
No.
The patient's vital signs are taken and recorded for the clinician. The assistant first takes and records the patient's pulse and respiration.
Okay.
Then, the assistant takes the patient's blood pressure.
I'm going to get your blood pressure now. You can just rest your arm right there.
A surgical cap is placed on the patient's head. Next, the dental assistant puts on a mask and performs a hand scrub.
Okay, I'm going to put this drape on you, Mr. Ferguson.
Now, a sterile towel is placed across the patient's chest, and the corners of the towel are clamped together.
Okay, you can lean back now.
The aspirating syringe is assembled for the area to be treated. And placed with the other instruments.
I'm going to hook this section up.
The assistant clamps the hemostats to the patient's towel. The surgical aspirator tip is placed on the suction hose. The assistant attaches the aspirator tip to a rubber hose that can be autoclaved. The hemostats are used to hold the surgical aspirator tip when the assistant is not suctioning. In this way, a sterile field is maintained at all times.
Good morning, Mr. Ferguson.
Good morning.
The clinician examines the most recent radiographs before the procedure is started. This procedure will show the extraction of a maxillary right first premolar. The clinician reviews the position of the tooth in relation to other teeth, the size of the crown, restorations in the tooth, and the root size and shape are examined. He also examines the bone density surrounding the tooth for ankylosis and the position of the tooth in relation to sinuses, nerves, and blood vessels. When assisting with oral surgery, a basic understanding of dental anatomy helps the dental assistant anticipate the clinician's needs. Usually, the maxillary first premolars have 2 roots. The roots are located on the buccal and lingual. However, only 1 root is visible on the patient's radiographs.
Remember, Pam, that the upper right first premolar has 2 roots. In this case, Mr. Ferguson seems to have only 1.
Okay.
Mr. Ferguson, we're going to anesthetize you, put on some topical anesthetic, and then the local anesthetic injection, and then we'll check to make sure it's numb, and then proceed to get your tooth out. Okay?
After explaining the procedure to the patient, the clinician will put on a mask. He will then wash his hands and put on gloves. The dental light is positioned for the procedure. The clinician and dental assistant may stand or sit during the surgical procedure. In this videotape, they will stand. The clinician examines the patient's mouth before the procedure is started. A 2x2 gauze square is transferred to the clinician. The topical anesthetic is transferred. The clinician anesthetizes the area to be treated.
Mr. Ferguson, do you feel that that's numb up there now?
Yes.
All right. Pam, can we have retractor and curette?
The clinician asks for the surgical curette and retraction. The assistant transfers the surgical curette. The Minnesota cheek retractor is used to retract the patient's cheek. The clinician cuts the gingival attachment around the tooth. The assistant removes the retractor and receives the curette. The assistant anticipates the clinician's needs and transfers the straight elevator. In addition to transferring the instruments, the dental assistant is responsible for maintaining a clear operating field with the surgical aspirator tip. The clinician applies lifting pressure on the tooth with the straight elevator. The clinician elevates the tooth. The assistant suctions as needed. The assistant anticipates the clinician's needs and transfers the forceps.
Thank you.
The beaks of the forceps are placed around the top of the crown onto the root surface.
You feel some motion, Mr. Ferguson, as I begin to manipulate the tooth.
And the tooth is moved in a facial to lingual direction. The tooth is removed from the socket. The clinician examines the extracted tooth to be sure that the root is not broken. The assistant suctions the surgical site and transfers the surgical curette to the clinician. The assistant wipes the curette with a 2x2 gauze square as needed. A clear operating field is maintained while the clinician uses the surgical curette to remove soft tissue debris in the socket. A 2x2 gauze square is transferred to the clinician. The 2x2 gauze is folded and placed on the extraction site.
Just close, please. Where's your lips together?
A damp 2x2 gauze square is used to remove blood from the patient's face.
Went very good, Mr. Ferguson. We'll just see you in a few minutes. Thank you.
The patient's surgical cap and towel are removed. The towel is used to cover the contaminated surgical instruments. This prevents the patient from seeing the blood-stained instruments. The assistant removes the mask and gloves.
Okay, I'm going to sit you up, Mr. Ferguson. You can just sit still, that'll be fine. Okay.
The dental assistant gives the patient the bilingual post-operative instruction form and extra 2x2 gauze. The assistant then explains the post-operative instructions to the patient. The patient is told to change the gauze every 20 minutes as necessary. The assistant explains to the patient how to change the gauze. If medication to control pain is prescribed, the patient is told how to take the prescribed medication. The assistant tells the patient that swelling is common after oral surgery, but varies from patient to patient. The patient is told how to place an ice pack over the surgical area on the day of surgery to control swelling. The assistant tells the patient how to apply a hot, wet face cloth to the swollen area 24 hours after surgery. The patient is told not to gargle or rinse for the first 24 hours. On the second day, the patient may rinse his mouth gently with salt water. The assistant tells the patient to eat soft foods for the first day after surgery. A special diet is suggested for the patient. The dental assistant suggests foods like milk, eggs, soup, and cereal for the patient the first day after surgery. The dental assistant tells the patient to call the dental clinic during office hours or the emergency room after closing hours if any problems occur. After the post-operative instructions are explained, the patient is questioned to make sure he understands the instructions.
Hey, Mr. Ferguson, do you have any questions that you'd like to ask me?
No.
All right, in that case, I'd like to see you again in 5 days, and if you'll go to the receptionist with Pam, she'll make an appointment for you.
All right.
Just follow me.
The patient is given an appointment in 5 days to check the dismisses the patient. The dental assistant has many important responsibilities. These responsibilities include preparing the tray, maintaining methods to prevent disease transmission, transferring instruments, maintaining a clear operating field, watching the patient, retracting, and giving post-operative instructions. The dental assistant's knowledge of the procedure and anticipation of the clinician's needs helps the procedure go smoothly.